President of Science Museum Oklahoma, and I am by myself right now in the studio here at Science Museum, so I'm going to go ahead and remove my mask. Museum Oklahoma, but anytime you come by the museum, in the studio here at Science Museum, so I'm going to go ahead and remove my mask. The reason we anytime you come by the museum, in the studio here at Science Museum, so I'm going to go ahead and remove my mask. The reason anytime you come by the museum, in the studio here at Science Museum, so I'm going to go ahead and remove my mask. The reason anytime you come by the museum, in the studio here at Science Museum, so I'm going to go ahead and remove my mask. Anytime you come by the studio here at Science Museum, so I'm going to go ahead and remove my mask. Anytime you come by the studio here at Science Museum, so I'm going to go ahead and remove my mask. Anytime you come by the studio here at Science Museum, so I'm going to go ahead and remove my mask. Anytime you come by the studio here at Science Museum, so I'm going to go ahead and remove my mask. Anytime you come by the studio here at Science Museum, so let's take a minute to get to know our panelists. It looks like we might be getting some feedback, so I'm going to check and see where that's coming from before we meet our panelists. I'm not sure where it's coming from, but we can figure it out. I'm going to go ahead and mute myself as we introduce our panelists. Let's start with a person that we've actually probably seen a little bit on TV lately. First up, we have Dr. Dale Bratzler, Chief COVID Officer for OU Medicine. Welcome, and please introduce yourself.
Yeah, thank you, Sherry. Good evening, everybody. I'm Dale Bratzler. I am the professor and chair of the Department of Health Administration and Policy in the Hudson College of Public Health, and I'm also a professor of medicine in the University of Oklahoma College of Medicine. As Sherry mentioned, I am the University Chief COVID Officer, helping to inform decisions around keeping people safe in our health system and also reopening our 3 campuses this fall. My research for more than 25 years is focused on prevention and treatment of a variety of healthcare associated infections.
Awesome. Thank you so much, Dr. Bratzler. Next, we have a specialist with allergies and asthma and a clinical associate professor of medicine at the University of Oklahoma. Dr. Laura Chong, welcome.
Thank you, Sherry. Good evening, everyone. I'm Laura Chong. I've been an allergist at the Oklahoma Allergy and Asthma Clinic since 2012, and I also have an appointment as a clinical associate professor at OU's Department of Medicine. And I'm really grateful for the opportunity to be part of this discussion on a really important topic that is really relevant for obviously our community.
Thank you so very much. We're glad that you're here with us. We also have with us Dr. Beth DeGrace, who is chairman of the Board for Autism Oklahoma and a pediatric occupational therapist. Welcome, Dr. DeGrace.
Oh, thank you, Sherry. Yes, my name is Beth DeGrace. I am an associate professor in the College of Allied Health in the Department of Rehabilitation Sciences, and I've been an OT for 30 years, working specifically with children that have disabilities and their families. Really excited to be here. Thank you.
Thank you so very much. And the next person is a little dear to our hearts. We have a specialist in pediatric hospital medicine who happens to also be a board of Science Museum Oklahoma, Dr. Monique Nafee. Welcome, Dr. Nafee.
Thanks, Sherry. I always love doing things with the Science Museum of Oklahoma. It's one of my favorite places. I'm a clinical associate professor of pediatrics and a pediatric hospital medicine specialist at the University of Oklahoma. I'm also a mother of 3, so I get to be around children lots of the time. I'm really happy to be here tonight and so excited to talk about something I feel so strongly about. Thank you.
Thank you so much. We are thrilled that you're with us. And of course, we are lucky to have the Chief Operating Officer for the Oklahoma City County Health Department, Phil Maytubby. Welcome.
Hey, it's nice to be able to speak to everybody here. My name's Phil Maytubby. I'm the Chief Operating Officer here at Oklahoma City County Health Department. I'm on year 30 as well, as of August 17th. So wow. I've been through about 12 different incidents. I'll just leave it at that. I think let's get to the questions.
Thank you. Yes, we've had a lot of questions, but as you can see, we have quite the distinguished panel with us tonight. And I know that you guys have been crazy busy throughout all of this. So thank you again for joining us and taking the time to join in the conversation. It is now my pleasure to introduce our moderator for the evening. You know her as one of the most trusted faces in journalism. Amanda Taylor can be seen on News 9 co-anchoring the 5, 6, and 10 p.m. newscasts and reporting on issues that are very important to Oklahomans. Amanda's been recognized with multiple awards for her work, which includes 5 Emmys, an Edward R. Murrow Award, Oklahoma Association of Broadcasters Award, Associated Press Honors, and Society of Professional Journalists Awards. Amanda, we are honored and thank you for being a part of this important talk. We're happy you're here. And with that, I'll turn it over to you.
Okay, Sherry, let's do it. Thank you so much. Thank you for that welcome. And I just want to say thank you to all of the amazing questions that we received. I am in awe of all the responses we got, all the questions, and really practical questions as well. Questions like, how often do you wash your mask? I want to know that. Okay, so we have a lot to get to tonight. I'm going to get right into it. We are going to ask our panelists to keep their answers to 2 to 3 minutes or so, just so we can get through as many questions as possible. With that, let's start our first question. This is going around a lot on Facebook, so I think this is an important one for us to address. It's from one of our viewers. They ask, isn't it true that Surgeon General Jerome Adams said that masks cannot prevent the spread of COVID and can actually increase the virus? Mr. Maytubby, would you like to respond to that one?
Sure. He actually did say that in late February that's when we also, let me just kind of preface this. The research wasn't out about pre-symptomatic and asymptomatic spread, and we had a shortage of masks. So really that was kind of a twofold attempt to try to get the public not to wear masks. But as you can see, when the evidence came out of the spread and the protective abilities of masking, then that tune changed, and he's been supporting mask wearing ever since.
You're right. Ever since about April, that's when he came out, and recently he's appeared on national news wearing masks as well. So yeah, so if you do see that on Facebook, know that that was something from an earlier comment. We appreciate that. Okay, this next question looks like maybe a good one for Dr. Bratzler. It's from Amanda, a different Amanda in OKC. She says, I heard that masks keep bacteria in and can actually make you sick. Is that true? She goes on to ask, isn't that how they keep people from getting COVID? By keeping the germs in? Dr. Bratzler, can you talk to us about masks and bacteria?
Yeah, so it's a great question, and I'm going to expand it to include both bacteria and viruses. So absolutely, when you wear a mask, it keeps those bacteria and viruses from getting out into the atmosphere around you, which is explicitly what we want to stop the spread of this particular disease. We've known since early days of tuberculosis, literally a century ago, that if you wear a mask, you can reduce the spread of certain diseases like tuberculosis. And certainly now, particularly over the past few months, there's been so much research that's come out now that has shown that when you wear a mask, you keep the droplets from coming out of your mouth. Those droplets carry the virus, and so we can reduce the spread of COVID-19. You're not going to make yourself sick by wearing a mask and holding those droplets in. Obviously, we'll talk more about changing and cleaning masks later, but remember, we're wearing a mask to stop those bacteria and viruses from getting into the environment around you.
Thank you. And thank you, Amanda, for asking that question too. I know a lot of people have been wondering about that and wearing masks. Our next question has to do with breathing issues. So I want to bring in Dr. Chong with the Oklahoma Allergy and Asthma Clinic. This is a two-part question. We actually got 2 separate questions on it. I want you to address both of them. The first one is from Judy in Oklahoma City. She asks, which masks are best for breathing since I have respiratory problems? We're hearing from so many people who are saying, I have asthma, I have respiratory problems. What do I do there? And then the second part of the question is, isn't it true that wearing a mask actually traps carbon dioxide in your system and can cause you to suffocate? Dr. Chong.
So I think first off with a question with oxygen and carbon dioxide, there are a lot of people with concerns that my oxygen levels are going to drop or my carbon dioxide levels are going to rise. And that's a misconception that's been out there. And the information I want to present especially with oxygen and carbon dioxide, it's a tiny molecule that's measured in something called picometers. A picometer is like 1/1,000,000,000th of a meter. So it is tiny, and it can easily pass through even these N95 type masks that people wear in a hospital. And so if it can pass through this type of mask, it can easily pass through a cloth type mask. And there have been information of people even wearing these types of hospital masks for 10 hours and measuring their pulse ox, which is measuring their oxygen levels with no drops. And so I think it's important for the community to know that that information has kind of been put out there, but if you really look at the science behind it, you should be easily traveling through your mask. So you shouldn't be having dropping oxygen levels or rising carbon dioxide levels. Now, when it comes to finding a mask, it's trial and error. Some people are like, well, I tried one, it didn't work. It's not going to work for me. I give up. And it is trial and error. You know, I almost use the analogy like for our ladies out there trying to find the perfect fitting jeans. It takes a couple tries. And so don't give up. Do not give up. And what I think would be helpful is something that's a cotton blend. So, you know, those cotton t-shirt type fabrics that feel really soft, or something from a sheet pillowcase type material. A lot of questions we get asked is how many layers, you know, would you prefer? And ideally be good to have 3 layers of fabric if possible. But if that's difficult for someone to wear, a 2-layer or a fabric plus a filter, and make sure that you can't see daylight through the mask. You know, if you can see the light through the mask, that's an issue. And although not as effective as a face mask, if it is difficult for someone to wear a mask, look into the gaiters or the bandanas to at least cover your nose or your mouth.
Okay, so maybe the next best option there if you can't wear the mask. Okay, Dr. Chong, thank you so much for that. We're going to get to a lot more questions here and about what masks are the best, but I want to have Dr. DeGrace answer this next one. This question may help us parents. Okay, this question, it's been asked. We've been either home or doing distanced activities outside this summer. My child will likely return to in-person school this fall. How can I help them make the adjustment to wearing a mask? Help us out, Dr. DeGrace.
Yeah, I need to help myself out too, right? I'm also like Dr. Napier, mother of 3 children. You know, when I think of this question, I think we can turn to the evidence, and what we know in the evidence is the more we can prepare a child, the better the success. So, you know, it'll be less scary and unfamiliar. So what are things that we can do to prepare a child? Well, first we can think of modeling the mask. So when we go outside or we go to the store, that we ourselves are wearing the mask, but we want to pair that not only by modeling it by wearing it, we want to pair it with very positive words. So we don't want to say things like, oh, this stupid mask, or, you know, I hate wearing this thing. We want to make sure that we keep our words positive, like, you know, I'm doing something good for my body and for others by wearing a mask. Mom gets to wear a mask, like how lucky am I, right? We also know that there are things called social stories that we can read to young children. And if you Google or look up the word social stories and mask wearing, you'll find wonderful stories about very simple and talk about like how sometimes we wear a mask and they're part of costumes, and sometimes we wear masks and we're a superhero. But, you know, now we're going to be able to wear a mask to school. You know, I had some other ideas like mask making parties, right? Have fun doing it. Choose your own fabric, decorate your own mask, practice on your dolls. I think the bottom line here is when you can keep mask wearing positive and fun, you're going to increase the likelihood that it's going to be successful.
That is so true. I had to make a video game mask for my 8-year-old son, and he thinks it's cool. So he likes that. The fabric was the winner there. Dr. DeGrace, thank you for answering that question. Kind of sticking with the kids theme, let me direct this next question to Dr. Nafi. This is from a viewer as well. This viewer states masks are dangerous for kids. Kids need more oxygen than adults, and masks prevent them from getting enough oxygen. Dr. Nafi, can you respond to that?
You know, it may be true that kids need more oxygen than adults. They are growing and they're more active often than we are. But I would suggest to you that actually they're far better equipped in their bodies to wear masks because they have far less chronic problems than adults do. So as an adult, you've experienced a whole lot more life, and maybe it's taken a little bit of a toll on your body. Children generally tend not to have some of those problems that come from just getting older. I would also suggest to you that, as Dr. Chong said earlier, oxygen passes easily back and forth through a mask, especially a fabric mask. I don't know that I'm suggesting that you send your child to school in an N95 respirator, but certainly a nice cloth mask is perfectly safe and reasonable to wear to school. And I would argue it's much safer to wear a mask and maybe feel like you're working a little bit harder when you're running around and playing than to not wear a mask at this point in time. And that may change as the year goes on. We don't know, but for right now, it seems safer to wear a mask than not. I also want to mention, I think, to be clear, masks will filter out the larger droplets that people tend to expel when they speak or breathe or cough or sneeze. And remember, the droplets are larger. We can see them with our eyes. But it does allow oxygen and carbon dioxide to freely pass back and forth through the mask. Those are microscopic. We can't see an oxygen molecule or a carbon dioxide molecule.
Mm-hmm. You're getting some head nods there, Dr. Naphy. So I think everybody's on our panels in agreement with that. And Dr. Chong, you were talking earlier about the type of mask people can wear and the different fabrics. We got another question, and this question comes from Heather. And I may bring in Mr. Maytubby on this one to answer it for us, and then anybody else can chime in if they'd like. This has to do with, there are so many choices of masks around there. I've seen patterns that call for 2 layers. I thought, well, 2's good, 3 must be better. So I make mine with 3 layers, but you know, what's the science behind that? So Heather asks, I make my mask with 2 layers of quilting cotton and a layer of tight woven linen cotton blend. Is this a good choice? What makes a good mask? Mr. Maytubby, if you want to start us off there.
He's on mute.
If you can unmute us, that would be great.
Sure.
Unmute you. Okay, yeah, start over so we can hear that.
Okay, that actually falls right in line with the CDC recommendations for making cloth masks, which is at least 2 layers of cotton fabric. Just remember the overarching piece of this is you've got to be able to breathe. I've seen people make masks out of what looks like upholstery material, and people will go up the stairs and they have to take it off to breathe. So, you know, it needs to be reasonable. It also, you need to have the ability to clean it, or you need to have the ability to use like a procedural mask or a surgical mask if you don't have the ability to wash it. And, you know, those are pretty readily available now. So I hope that answers the question.
That does. Does anybody else want to chime in on the fabric type? I mean, obviously not upholstery fabric, but just a cotton blend. Is there an opinion, a scientific opinion on what's a better fabric out there?
So this is Dale. A couple of points. Number one, I recently was on a presentation that said, what's the best mask? It's the one that people will actually wear. Because if you won't wear it, if you don't like it, you're not going to wear it, and it provides no benefit. But there actually are very, very good studies now that have been done showing that a simple 3-layer cotton mask will dramatically reduce both those large droplets you can see, but also the microscopic droplets you can't see from getting out of your mouth. So find a mask, surgical mask, cloth mask, find one you're comfortable in that you can wear, and it will be helpful to the people around you.
Dr. Bratzler, I'm seeing more and more online on Amazon. You can buy filters to put in masks. I've heard just fold some paper towels and put it in a mask, get something else in there for a filter. What are your thoughts on adding even a filter to your cotton mask?
Yeah, so again, the principal reason for wearing the mask is just to catch droplets. So I think a filter may help a little bit, and maybe you have a 2-layer mask with a filter. I think that's fine. Again, my primary thing is find a mask that you feel comfortable wearing, that you will wear, and use that. I like surgical masks when I'm outside when it's warm, but typically when I'm inside, I'm wearing a cloth mask that does have a filter in it.
Okay, let's stick with the mask topic for a moment because we got another viewer question on this. And Dr. Bratzler, while I'm talking to you, I'll have you answer this one. A lot of us are required to wear masks to work, wear masks for a long period of time. So this person asks, how long can I wear a mask at a time? And can wearing a mask cause long-term medical problems?
So
how long?
The answer to the second question is simple. No, it won't cause any long-term medical problems. My research over 25 years is focused on preventing surgical infections, and I can't tell you how many times there are operations that go 10, 12 hours at a time, really complex operations where people that are doing very detailed, fine work in the operating room have to wear a mask for long periods of time. So you can wear a mask for a long period of time. Obviously, you can't wear a mask when you're drinking or eating, so you will take it off periodically. But really, the mask that we're talking about, surgical mask, cloth mask, freely allow air, oxygen, carbon dioxide to come through, pass through, and don't cause any medical problems.
And I think another point to add is you want to make sure that the material is a solid material. You don't want something that's a mesh where obviously the particles can actually be emitted out of the mask. So they are selling those types of things out there, but that is not really a valid option at all.
Dr. Chong, while I'm talking with you, we had another question from another viewer, and this particular viewer has asthma. And this person is asking, is it safe for me to wear a mask? They have asthma. They say, I've heard masks drop your O2 level. Won't it make it even harder for me to get enough air to breathe? So is it safe for somebody who has asthma?
So we really do think it's important, obviously for our asthmatics in particular, to get your asthma under good control. So the analogy I use is when you're wearing a mask, the effort used in wearing a mask is no more than an effort that's used when you're using an inhaler. And that's something that a lot of people with asthma commonly obviously have, whether it's something they use as needed or on a regular basis. So if you feel like you're struggling to breathe, whether it's just at baseline or even that much when wearing a mask, you need to kind of step back and think, is my asthma overall under good control? Because if it's not, obviously you need to talk to your doctor, you need to get that addressed, because as we get through the next couple months, we're going to be dealing with fall allergies. Obviously, we've got Corona going on, and then of course the flu season coming up. So I want people to, in a sense, go into this with a shield of armor. So if you are at a point where you feel like I can't breathe just at baseline because of Oklahoma, or, I can't wear a mask to that point where I'm having that much trouble breathing, you need to take a step back and look, what do I do with this underlying issue first? Because that's going to be influencing other things, not just obviously with mask wearing. So,
Dr. Chong, thank you for answering that question for everybody who has asthma out there, and they're wondering that. I want to bring in Dr. DeGrace for our next question. Dr. DeGrace, of course, the chair of the Board for Autism Oklahoma. And this question, Dr. DeGrace, came up frequently for us as we were looking over the questions. And this question is, what tips or recommendations do you have for introducing masks to kids with sensory issues? This is a real issue.
It is a real issue. And what we know from the evidence is that people process sensory information differently. And some process it in a way where they're very sensitive, right, to it. So you can be sensitive to smell, you can be sensitive to sight, you could be sensitive to touch. And a lot of those things play a role in mask wearing. So when we think of how can we support a person that processes information differently, we can break it down, right? So if it's a smell, what can we do to modify the smell to be something that the person enjoys, right? So we can put it maybe with a familiar smell from home. We can look at various textures. Certainly there's been discussion right tonight, like maybe something silky or something soft, like cotton jersey material that has a little bit of stretch to it. And thank you, everyone. I think those have been really good tips about the number of layers and stuff like that. One of the things when I'm working with children that have autism, we try to break it down, to steps. Certainly we don't want to go full hog and do 15 minutes of mask wearing the first time out, but we might say 1 minute. And you did it, buddy. You did 1 minute. That is so good. And then following up the minute with positive reinforcement. And I want to emphasize positive reinforcement because what we know from the evidence is that anytime we punish or do consequences, that decreases the likelihood that somebody's going to comply. So we want to do things in a positive way. So things like, you've all heard about this, like sticker charts or treasure chest, or for an adult might be shopping at J. Crew or, something like that. But this idea of this positive reinforcement, again, modeling and social stories. We can also script language. So there's, you can do this through cartoons or through little snippets, like I'm going to be fine wearing a mask. I'm going to be fine wearing a mask. Mindfulness and breathing. We can teach kids breathing exercises to reduce the anxiety that they may have with wearing a mask. And then breaks. I don't know what other people think about this, but saying, 5 more minutes, buddy, and then maybe we can have a break. I don't know what the rest of the panel thinks, but just that opportunity of getting through a stretch and maybe having a break at mask wearing. I'm just throwing that out and pass it by anyone else. And the last thing, too, is I want families to be reminded that they need to take care of themselves too, because it is challenging when somebody is fighting you, to wear a mask, that they take time to restore, themselves.
Thank you so much. I know you probably just helped quite a few parents with that answer.
Oh.
We appreciate that. Our next question is from a worried viewer, and Dr. Nathie, I'll address this one to you. This worried viewer says, quote, "My children are involved in sports and marching band. They are being told to wear a mask during practice and have been told that there may be a mask wearing during games. I'm having a hard time with allowing my child to wear one while exerting energy, sweat, and already in the heat. I have a hard time breathing while wearing a mask just going to the grocery store. So is this safe?" Dr. Nathie?
First of all, yes, it is safe. Bottom line, it is perfectly safe. It can be uncomfortable. It may make the sport they're playing slightly more difficult. But if everyone is wearing a mask, that should be the same level of difficulty, add the same level of difficulty for everyone. I can tell you personally, both of my older 2 children participated in athletics this summer that required them to wear a mask while they were indoors. And they did just fine. I don't think it was their favorite thing. Now, I did accidentally put on one of their masks in the afternoon after they got home without realizing it was theirs. My daughter and I have a similar fabric on our masks, and it does not smell good. So I am going to recommend that those masks get washed pretty frequently. But they survived. And actually, I would tell you, my daughter said to me, "I think I have more aerobic capacity." Like she didn't say aerobic capacity, but I am more fit than I would have been. She's only 14, but I am more fit than I would have been if I hadn't had to work out in a mask when I was indoors, because I think it does. I mean, we all know it feels like it's a little bit harder to breathe when you're wearing a mask. Now, physiologically, on the level that your body is working, it's not more difficult. You are exchanging oxygen and carbon dioxide just like you would otherwise, but it feels like it's a little bit harder. I also want to make sure to point out that often athletics, especially indoor athletics, and singing or marching band activities are thought to be possibly super spreader, what we call a super spreader event, because of the forceful exhalation of droplets, and on your droplets come potentially virus particles. And often kids are not very symptomatic or even asymptomatic. And so certainly an asymptomatic or a pre-symptomatic or a mildly symptomatic person could easily spread COVID-19 to the peers that they are exercising or practicing or singing with. People bring up the example from California, but there was early on in the pandemic, there was a choir in California where there were, I believe, initially 1 to 2 infected members, and then approximately 80 some odd people got sick, and they had socially distanced during their choir practice. So certainly we should all want our children to be wearing masks during many of those activities. Now, I'm going to be very honest. When the questioner said that marching band and a mask, I don't actually know how that happens, but because I don't know how you would play your instrument in a mask, but my suggestion would be that parents ask the school to have the marching band practice outside, that really there should not be any indoor practices, because that seems like it might be, the evidence shows us that is likely unsafe.
Well, I was wondering that too. It's like, how do you wear a mask when you're playing the trumpet? Does any of our other panelists have any insight on what should be done in those cases?
Go ahead, Dr. Bratzler.
Yeah, the only other thing I've seen is some early research looking at band instruments where people are actually putting a mask over the end of the instrument itself, which actually will stop some of the droplets and other aerosols that may actually go all the way through something like a trumpet or a clarinet or a trombone. So there are some nylon type caps that can go over the end of the instrument, which will reduce the number of droplets that come out of the instrument itself.
People are super inventive. That's impressive.
They have to be, don't they? Okay, thank you all for chiming in. Okay, I want to move on to our next question, because this is another common one we've seen over and over. Mr. Maytubby, I'll address this to you. And the question is, if I wear a mask, do I still need a social distance? And if so, why?
Sure, and the answer is yes, and I'll tell you why. We're wearing cloth masks, we're wearing surgical masks. None of these masks are 100% effective. And the more distance you can put between people really reduces the amount of exposure that you're going to get and the amount of viral particles that you might potentially inhale. So yes, we definitely recommend that you still distance.
Okay, thank you for answering that question. The next question, let's address it to Dr. Bratzler. This is from Cassie in Oklahoma City. You see those disposable, the surgical, or I guess non-surgical masks, disposable masks, they're everywhere now. You can see them in grocery stores. So Cassie is asking, do the disposable non-surgical masks being sold everywhere offer me any protection? I am happy to wear a mask to protect others, but I'd like to know a way to protect myself too.
Yeah, so it's a great question. And I always separate mask into the type that Dr. Nafee might wear when she's rounding in the hospital versus the type of mask that I wear when I'm out in public, where my principal reason for wearing a mask is to keep droplets in and to protect the people around me. Yes, any mask that you're wearing will potentially filter out some of the droplets or aerosols that may be in the air around you that you could be breathing in. So I would say, the most important thing is to wear a mask. That's number one. Wear one that's comfortable. And you're right, you can buy these, they look like surgical masks, but they're classified as non-surgical. They're actually quite similar to surgical masks. You can buy them in boxes in all sorts of places now. And I think it's an inexpensive way to have disposable masks that you can wear. But again, if you're not wearing a mask, it won't help you at all. So.
At the end of her question, she was saying, I'd like to know a way to protect myself too. Is there a certain mask that's better at protecting us as well, especially if the people around us are not wearing masks?
Yeah, so in particular, if you wear a mask that actually fits a little bit tighter and covers your entire nose, mouth, and maybe seals in around your face a bit, that's why I actually, except when I'm outdoors doing things, I like wearing a cloth mask. I have one that fits very, very tightly to my face, and I feel very comfortable in it because I know when I breathe in, air has to come through the mask itself and it's not getting in around the edges. The other thing we haven't talked about, we may talk about a bit later, is face shields. Some people are using face shields, which also offer some additional protection. There are hospitals and other centers in the country where everybody's wearing both a simple surgical mask with a face shield, and that provides incredible protection.
Dr. Bratzler, while you're on that comment, because that was one of the questions, but I'm afraid we might not get to it. And I know a lot of people are wondering about those as well. So the question the viewer asks is, can I use a face shield instead of a mask? Is it more or less effective?
So there's actually very good research on use of face shields to protect you, the wearer. We know in influenza that face shields are very, very good at protecting the person wearing the face shield, and they protect both the eyes, the nose, and they can protect the mouth. Now you need to make sure you have one that gets down below your chin and it comes around the sides of your face. That said, the one area where we don't know whether it's very good to wear a face shield is in what we call source control. In other words, if I'm infected and I'm wearing a face shield, there's still a lot of droplets and aerosols that can come out of my mouth and come out around the face shield. So it may protect me, but it may not protect you when I'm wearing one. So that's why some of the hospital systems that are using them are actually combining the face shield with something like a simple surgical mask.
Would you suggest the general public doing the same?
I think if a person is at high risk, for instance, you're a diabetic, maybe you're a cancer patient, you're immunosuppressed for some reason, then yes, wearing two masks, we see people do that all the time, wear a surgical mask over their cloth mask. The extra layers will potentially increase your protection.
Dr. Bratzler, thank you. I will move on now to Dr. Chong. You talked earlier about people who have asthma. This question comes from somebody with allergies. So many of us deal with this. They say, I struggle to breathe because of seasonal allergies, which in Oklahoma seems to be all of the time. And I can't imagine wearing a mask too. Help the people with seasonal allergies, Dr. Chong.
First of all, I feel for you. Everyone, in the allergy world knows it feels like Oklahoma has a season that is like 12 months a year. It feels like we never get a break. And if people are having allergy issues that's affecting to the point where they have difficulty breathing, kind of what I alluded to before is you have got to get help in addressing your symptoms and what can you do to get these under control. We all know Oklahoma allergies aren't going to go away. We're not going to have ragweed go away this fall. There are certain things we're always going to be exposed to and be around. And so if you're struggling to breathe in general because of seasonal allergies, definitely you need to get help. You may need to be on certain kind of inhalers or certain kind of medications to help control your symptoms, because allergies is really an immune response. In a sense, it's kind of like your immune system attacking things that are out there, and you're going to war in a sense with different indoor or outdoor allergens. And so, I've been telling a lot of my patients these next few months are really critical, because we're obviously dealing with things we haven't been dealing with before. And so this is a time that you really need to address that issue before we get further, like I said, into other parts of peak fall allergy and also the flu season. So, don't give up, don't feel like, oh, I'm just stuck. This is where I'm at. Like, get your issues addressed as soon as possible so that you are able to wear a mask to protect yourself, and also just in general, get your allergy symptoms under control, especially if it's affecting your breathing.
That's miserable. Dr. Chong, thank you. Our next question, let's address it to Dr. DeGrace. This person says, my child has special needs and asks, is a mask safe? We can't stay home forever. And Dr. DeGrace, if you'll just, there you go.
Yeah, so you have to remember to unmute before you talk. So when we think of special needs, we can think of special needs in a couple of different ways, right? So a child could have something that influences their motor skills, right? So it could be something like cerebral palsy or anything, that may affect their movement. So one of the things as a therapist I would think about is, what is their range of motion, or how do they move, right? So can you move up to take off a mask? That said, as an occupational therapist, we can think of ways to adapt a mask, and we can think of ways to actually teach, right? Break down like motor learning, and think of ways where we can actually work on it. I bet OTs and PTs in the schools might work on this, taking on and taking off your mask. I think one of the things when I think of safety and I think of children that have limited verbal skills is, how are they going to communicate? And there's ways to communicate that don't rely on words. So we could have like I need help taking off my mask card, or some sort of augmentative communication. So that might be something that families want to think about if their child has differing needs. And then I just want to emphasize too is that as a child develops, it's really important for them to do it themselves. It's something that's typical. And, oftentimes with children with disabilities, we do things to children, right? And, it would be great if we could problem solve a way where they could be in control of taking on and taking off their mask. Now, the question about safety, I'm going to turn to others on this panel who maybe know a little bit more about that information than I do.
I would like to answer that.
I'm
Yes,
happy
please.
to address that one. The American Academy of Pediatrics and the CDC have both come out sort of suggesting that if a child is truly unable, even with adaptive measures, to remove the mask themselves, it probably is unsafe for them to wear a mask. Certainly, it is not reasonable to have anyone less than 2 years of age wear a mask because they can't remove it themselves. But anyone who is able to actually remove the mask themselves should be capable of wearing a mask and should be expected to wear a mask. I think there are a couple of keys, and I think Dr. DeGrace has been right on all night long. I've just found myself nodding along with everything she said, right? It is sometimes frustrating to be a parent, and it just takes time. You have to figure out what works for your child, and it may take more than one try. Think about how long it took for those of you who have kids who can tie their own shoes and wear shoes that tie, to learn how to tie their own shoes. It's the same idea. And so I think the more we can teach kids to do for themselves, the better off our kids will be, because kids feel good when they could be independent.
Dr. Nathy, thank you. While you're talking, let me just have you address this next question from a viewer. This is from Amanda in OKC. Do my kids need to have a new or different mask for each day of the week as they go back to school if they're choosing that option?
I love this question. I want you to know my 14-year-old made me order her 4 new masks yesterday because she liked the way they looked. And I was happy to do it. Kids do not need a new mask for every day. And actually, it's relatively easy to clean a mask. You can iron it if it doesn't smell bad on a hot setting, which will kill germs. You can run it in your dishwasher. You can run it in your washer. I have a little sink that has like a spin thing, so you can run it in a sink with soap and water and just soak it for a while. There are many, many ways to do a quick cycle on a mask wash, but I think it depends on your child. So if the mask is visibly soiled, absolutely has to be washed without question. Certainly every couple of days is what I would recommend for a mask that is worn sort of as an all day long at school type situation. But like I said, if the mask is soiled, it absolutely has to be washed. And so it just depends on your tolerance for laundry. Probably if it were for me, I would buy a mask for every day of the week and do the laundry on Saturday. But everyone's slightly different. And like I said, you don't necessarily have to launder a mask in the washer. You can do any of those other things to kill the germs as long as it's not visibly soiled and doesn't smell bad.
Dr. Nathy, thank you. I'm going to skip around a little bit because that kind of leads into one of our questions that I was going to ask a little bit later. And Dr. Bratzler, I'll have you chime in, and then anybody else who wants to. This question, how often do I really need to wash my mask? If it's airing out in between wears, wouldn't the virus just die on it?
Yeah, it's a great question and it comes up often. In fact, I see people highlighting that, well, that's a reason not to wear a mask, because we see people out there hanging them on their rearview mirror and taking them out of their purse and things like that. You know, when we're in the hospital, in the intensive care unit or emergency room, we have COVID patients, we absolutely do worry about the surface of the mask and what's on it. And we're very, very careful about taking them off very carefully and doing lots of hand hygiene before and after and other things. But the reality is, when you're out in the community, maybe you're at the grocery store or something, you're probably not getting near the level of contamination by viruses or bacteria on the surface of the mask that we would see in a healthcare setting. So I think you don't have to have that same level of rigor about taking care of the mask. And I actually, again, if people will wear a mask, I'm all for it. And if they pull it out of their purse, so be it. I'm just fine with that. Now, what we do in the hospital setting and what we're doing at the University of Oklahoma with our students is we're going to give them a bunch of masks. We're asking them to wear their surgical type mask for up to 5 days or until it becomes soiled, and then dispose it and they can get a new one. Or for face masks that are cloth, I think, again, in part it depends on whether it's soiled or not, or as Dr. Navy said, if it's starting to smell. The ones that we give to staff to wear in the hospital who are not doing patient care, they're just in the hospital, we actually wash daily. But I don't think that's required necessarily for people that are not exposed to the types of viruses and bacterial infections that the people that we have working in the hospital. So I think a little common sense, if it's soiled, wash it. I think Dr. Navy did a great job of highlighting there are lots of different ways to clean a mask. If it has a filter in it, take the filter out first or change it.
The second part of that question, and maybe you can address it again, is if it's airing out in between wears, does the virus die on it? Like, how long does it take the virus, if it happens to get on your mask and you hang it up, how long would it take for it just to die so you wouldn't have to worry about washing it?
That's a great question. So there actually were some studies early on that showed that on hard surfaces, like if you have a granite countertop, the virus probably lives longer there than it does on a cloth surface. So most studies suggest that within 24 hours, you could not culture the virus. So that's typically what I tell people within a day.
Interestingly, those that hang it from their rearview mirror may be sort of inadvertently doing something that's quite intelligent. UV light kills the virus, and so you hang it on your rearview mirror, and then you park your car outside. That is certainly a reasonable expectation that any virus on that mask would probably die based on exposure to UV light.
Yep, I agree.
That's one of the methodologies we have right now to control it. So.
Yes, right.
And Mr. Maytabi, I'll let you answer this next question. It's from a viewer. What if the virus gets on my face covering? Isn't that more dangerous?
More dangerous than breathing it in? No.
Because it's going to trap it, and now it's on there, and you're definitely going to get it because it's on there and you're breathing it in. What do you say to them?
No, it's because it should be trapped within the mask material. So that's the whole point. One of the points of the mask is to catch the droplets. So is it more dangerous? No, especially if you're handling the mask properly. When you're going throughout the day, you're probably going to know if you've had an exposure. It's like somebody's going to sneeze, or you're going to have somebody, that's done something around you that's going to kind of alert you that, hey, I might have just been around somebody that I wasn't aware of, and I might need to handle my mask a little differently. So, as long as people take the mask and, if it's on and they handle it correctly, they pull it off by the strap back here on the straps and then take it off, it's not going to be any more dangerous.
Okay. Dr. DeGrace, you might be able to answer this next one. This viewer says, I'm claustrophobic and suffer from anxiety. I can't wear a mask. What can I do? We've heard from a lot of people like that. They do not like that feeling.
Yeah, and I think I would start with the can't, right? So you're defeating yourself when you just say, I can't do this. So I like to tell people that have anxiety is I can't do it yet, but I'm working on it. So I encourage people to start off with mask wearing in low demand situations, right? So we don't want to potentially wear a mask as we're in the middle of Target in the checkout line and we have 10,000 people around us. That wouldn't be good. So I would encourage you to start wearing a mask perhaps at home in a place where, like I said, like low demand. The other thing is, mindfulness. There's a lot of evidence and research about using techniques of mindfulness and particularly deep breathing. So just learning how to control your own breathing, like breathe, and I forget, I think it's 4, I'm going to be wrong because I don't remember exactly the numbers, but taking a deep breath, holding your breath, and then letting it out has been pretty efficacious in reducing anxiety, which is related to claustrophobia too, is that feeling that fight, or flight feeling. I also like to use the UGG butt. So, so it's all like these mental scripts that you can tell yourself, like, ugh, I have to wear a mask, but I'm keeping myself safe. So again, it's just this way of reframing how you think of situations.
That's good. I think a lot of us could use that in different circumstances as well. I like that. Thank you.
Adults can use a lot of the tools we use for children too, right? We don't necessarily expect our 4-year-old to be able to go out and wear a mask for 4 hours all at one time, first go, right? So give yourself a break a little bit. Reward yourself. Absolutely. Adults need rewards too.
J. Crew.
There you go.
There you go. Dr. Nafee, so many of us have been trying to social distance from our elderly relatives, and we just miss them so much. And this person asked, if I wear a mask and my grandchildren wear a mask, can we hug?
My heart hurts when I heard this question. We haven't seen my mother and my father in months, and we're talking about going this weekend to visit them. And I've had the same thought in my mind. If we all wear a mask, would it be okay? And I think the bottom line is we don't actually know. And so what I've been suggesting to people is that you really have to consider what we call a risk-benefit analysis. In other words, do the risks outweigh the benefits, or are the benefits going to outweigh the risks, whatever they may be? I would suggest, and I have seen it discussed other places, I'm not just making it up, that if both parties are wearing a mask and facing their mouths and heads away from each other and hug, so the person would come in for their hug on this side of me and be looking that way, that perhaps that decreases your risk. Now, it is clearly very, very important in all of these situations that we are using lots of really good hand hygiene. In general, when you look at studies of infectious disease like influenza, for example, there have been multiple studies done on hand hygiene where they had sort of one group of people wash their hands 4 or 5 times a day on purpose. You have to wash your hands once every 2 hours or something like that, whether you feel like they're dirty or not. And the other group just washed their hands whenever they thought they were dirty. The people in the group that were forced to wash their hands more often as part of the study got sick far less often than the people who just washed their hands as they felt like it. So my kids and I have sort of developed a routine. My older daughter, my 14-year-old, likes to go to the grocery store with me, and I like her to come because it makes the trip twice as fast, basically, right? So we will clean our hands as we go into the store. And we are very careful not to touch our faces or our masks as we're in the store. But as soon as we finish checking out and we've loaded our groceries in our bags and we're headed out of the store, we'll clean our hands before we get in the car. Just because that's when we remember. But it's good to have sort of a predetermined, this is how often I'm going to wash my hands today, right? And probably it just needs to be every day until we're done with the pandemic.
Dr. Nafee, while I have you here, let me have you address this question from a viewer who says, my kids just won't wear masks. Does it really matter? They're just kids. We've seen some statistics. So what do you say to that?
You know, I would argue that it does matter, especially if your kids are 10 or older. There is perhaps some evidence that children less than 10 are less likely to spread the virus. However, your kids are going to go back to school, and most likely their school is going to require them to wear a mask. And so for that reason, I would argue that we should have everyone who is able to remove their own mask, so anyone probably over the age of 2, start practicing mask wearing, because it will keep us all safer. But yes, it does matter. Maybe again, they're less likely to spread disease. We don't actually, well, I think there is some evidence for that actually, but it will matter for them, right? Because we all want our kids to go back to school in school. And if wearing a mask keeps our teachers well and keeps our children well and keeps them in school, I think it's well worth it. And again, I think Dr. DeGrace has lots of ideas about how to get kids to wear a mask. She's already talked about a lot of them, but I will say, and I'm a big believer of this, kids will take their lead from us, the grownups. And so, and I'm telling you, I've got some teenagers that live at my house, and you better practice what you preach, because I promise They are not going to do what you say. They are going to watch what you do very astutely and do what you do. And you might think you're doing it on the sly, I promise. They are very, very observant, and they will do what you do. So, you know, set a good example. Sigh inside, scream in your heart. What was the Japanese, the roller coaster, the Japanese theme park? They said scream inside your heart because it's not safe to scream out loud. If you're going to throw a fit about wearing a mask, do it inside. Don't say it out loud, and use some sort of a predetermined script. Oh, we get to wear a mask so we can keep everybody safe today.
Thank you, Dr. Nafi. I appreciate it. I want to get one last question in, and then we'll go through the panel just for any final thoughts. Dr. Grace, this one will be for you. It's from Kay in Yukon. This is tough. My mom has dementia, refuses to wear a mask. She has to go to a doctor's office. She has to go to appointments where masks are required. Any suggestions for a situation like that?
Yeah, that's really tough. I actually, when I saw that question, I reached out to a therapist that's actually doing research in Alzheimer's, and it's interesting because a lot of the same principles apply to older adults with dementia that apply to younger children. So again, keeping it positive, not turning it into a fight, looking for things that are pleasant, right? And again, keeping the environment a low demand environment. So, looking at how much you're pushing. I guess, essentially, and then I think everything else that we've already talked about, but it is a tough one for sure. Patience.
Yes, patience. Well, thank you all so much for answering these questions. I'd like to just get your final thoughts before we say goodnight. And Dr. Dale Bratzler, I will start with you.
Thank you, Amanda. So a couple of things. One, I think all of us have highlighted that masks aren't perfect. It won't prevent all infections. But I saw a study earlier this week that really caught my attention. And that is that if masks were only 30% effective at preventing spread from one person to another, only 30%, it would reduce the number of deaths from COVID-19 in the United States by about 67%, by 2/3. Now just imagine that. There have been 150,000 deaths in our country from COVID-19. And if we could all get to wearing masks and they're only 30% effective, we might have prevented 100,000 deaths in this country. I think it's a small price to pay to save somebody else's life. And I think we should really focus on making sure we get to wearing masks until we have a vaccine where we can get rid of this virus.
Dr. Bratzler, thank you for your time tonight. Dr. Laura Chong, your final thoughts.
I think with everything that has happened with COVID, people feel so much uncertainty. They feel there's been so much just control that's been lost. And I think, like Dr. Bratzler mentioned, what are things that we can do? And this is going to be a collective effort. This is not just one individual. We all are actually in this together. And the importance of social distancing, hand washing, and mask wearing. And so I think, honestly, with the rates, the way things are going in Oklahoma, it's imperative that every single person really do their part to help overall with the big picture. And so that's one thing I think I want to stress is we're all in this together. Everyone is going through all these different range of emotions, obviously with what has been going on, but we are in this together. And so we all have to do our part to really help with the situation, particularly that we have here in Oklahoma.
Dr. Chong, thank you for your time tonight. Now let's get final thoughts from Dr. Beth DeGrace.
Oh, thank you. Thank you for this time. It's been very humbling to listen to everyone speak, and I absolutely learned a lot from each one of you. As a person who's spent her career helping children with disabilities just be a part of everyday life, I would hope that people are patient to those that are patient to those that are vulnerable, and understanding that it's very difficult for families who have children that may have sensory differences, and just be supportive of one another. And I think, like Dr. Chong said, it's a time to come together. and be respectful. So thank you. Thank you, everyone.
Thank you, Dr. DeGrace. And now Dr. Monique Nafee with your final thoughts.
Mine are pretty simple. One is, it is vital that kids go back to school. So to help them safely go back to school, please wear a mask. It is really, really important. If we can all wear masks when we go out in public and decrease our community spread of COVID-19, our kids might actually get to spend the whole year going to school in school. And it is really vital for them, especially those that are the most vulnerable. This is really a key driver for me in my life, right? What can we do to get the kids back in school? When I was younger, my parents used to talk about being a good citizen. Well, right now, being a good citizen means wearing your mask when you go out in public, whether you think you're sick or not, because you might not know. And I know the vast majority of people would feel horrible if they accidentally infected somebody who really got sick.
Dr. Nafee, thank you for being on our panel. We appreciate it. And Mr. Phil Maytubby, your final thoughts.
Oh, hey, Amanda, thanks for moderating this event. I think it's been very helpful for everybody. So I guess a few key points. This isn't going away anytime soon. We have got to learn to function in this environment, and it's possible. People have to pay attention to what they're doing out in public. We need to mask. Our economy depends upon it. And this is about freedom of access. I think everybody likes to have the ability to go out and do what they want to do when they want to do it. And that is possible if we do these things. But if it fails, that's when we are going to have issues with freedom of access. Like if you want to go to a restaurant or if you want to go to some other activity that you want to go to. So, we implore that people wear masks. It's vital. And, Dr. Nafee brought up the school piece. We can't have school without people wearing masks. It's just not possible.
Mr. Maytubby, thank you. Now I'll turn it back over to Sherry Marshall with Science Museum.
Thank you. That is so encouraging to hear from every single one of you all. We appreciate your time. We did have lots of questions that didn't get answered tonight, but we do intend to continue the conversation. So thank you to all of our panelists, Dr. Bratzler, Dr. Chong, Dr. DeGrace, Dr. Nafee, and Mr. Maytubby. Thank you all so much for joining us, and special thanks to our wonderful moderator, News 9's Amanda Taylor. And thanks to you, our viewers, who submitted the questions that we are watching right now to get good answers. For more information about the science of masks, visit our website. It's www.sciencemuseumok.org. We'll have video clips from tonight and other resources. We're hoping to gather some resources that you all can access that will help us continue this and look for more information as we continue this journey as one community to come together and get past this. We'll have video clips and hope you better can understand why masks matter. Thanks again for joining us tonight. I'm Sherry Marshall with Science Museum Oklahoma. And I just ask that you please stay safe and wash your hands, and let's wear our masks. Thank you.
Thank you.
Thanks.